Okay, I think we can start. From last night, we have received 200 registered participants, and now we are on 96, but I don't think we can wait for everyone to go online. So let's begin. Can everyone hear me?
Yes.
Okay.
Yes.
Thank you so much, everyone, and good afternoon. Welcome to the UN Women We Empower Asia Philippines and Oxfam Philippines Conference. This we hope to discuss economic impacts of COVID-19 pandemic on women, supported by European Union Delegation. We hope that you are all safe and well during this trying time. We also recognize I am muted by the host. Jean? Hello?
Yes, we can hear you, Len.
Okay, thank you. So we recognize that participants and guests in this conversation are not just from the Philippines, but we want to highlight that the reflections and perspectives to be shared by our guests or our resource persons are coming from the Philippine context. We surely hope that there can be lessons and takeaways for all of us in this conversation. And we also hope to host a similar web conference at the regional level in the very near future. So please wait for announcements linked to that too. Before we begin, allow me to run through some reminders. As part of our effort to keep the pandemic under control and flatten the curve, we have decided to take several of our Women's Month activities with our partners online so that you may participate in the discussion from the safety and comfort of your homes. To make the web conference more effective, please note the following. During the presentation, we recommend you to turn your camera off and mute on your mics so that we can avoid interruptions to the speaker's presentations. While we want a free-flowing discussion, we may mute everyone to avoid talking over each other and ask you to signify if you would want to raise a question by typing your name in the chat box. Please also include your name so we can unmute you because some would just appear to be mobile phones in our screen. Before you ask your question, kindly state your name and organization. If you experience technical issue, please raise your hand and one of the hosts or organizers will colleagues as this is our first time to host such event. You after this meeting. Finally, please be advised that we are recording this meeting for purposes of documentation. Okay, can we shift our slides, please, to the opening slide and title slide? Thank you. Moving on, we are culminating the end of the International Women's Month celebration in unfortunate time for all of us. As the world and our country grapple with the COVID-19 pandemic, we are all faced with a serious challenge with the number of Philippine cases increasing at a rapid pace. This web conference was convened despite time constraints because of the crucial need to make available a platform to discuss and reflect on insights and different perspectives on how the COVID-19 crisis impacts women. And we thank our speakers and panel members for making themselves available even with very short notice period. Pandemics affect everyone, regardless of gender, class, or creed. But as we all continue to assess the impact of COVID-19, we see that the burden falls heavier on women's shoulders. Women are serving in the front line as health workers, essential service providers, business continuity support staff, and they're all so vulnerable because they make up a disproportionate part of the informal, contractual, non-regular workforce that probably won't get paid under a lockdown situation. Figure doesn't include the unpaid care work that women do as the main caregivers of the family. On the business operations side, it is estimated that 9 out of 10 businesses are MSMEs, and majority are women-owned or led. They are an integral part of supply chains and clearly will bear the brunt of the enhanced community quarantine as large companies suspend operations, stop orders or payments to cut costs and losses. These MSMEs are faced with difficult decisions to continue or not their operations as they manage risks related to the lockdowns, contamination, and huge capital losses. We hope that this afternoon would give us an opportunity to reflect on the perspectives and insights to be shared by our speakers and towards the end, identify concrete steps and actions we can take individually or as a group as we move forward. To formally begin the discussion, may I call on Ms. Stephanie Carrete from the EU Delegation to give her opening remarks. Stephanie?
Good afternoon, everybody. It's a special session today indeed. So as a representative of the European Union, I'm happy to be here today to open this important session in these peculiar times in the framework of the WeEmpowerAsia program. Today, communities, families, and individuals are isolated by the pandemic. The lockdown measures have, unfortunately, a specific and negative impact on women and girls especially. Women who are the sole caretaker of their household with economic insecurity. Women who are at risk of social exclusion and homelessness. Women who are at risk of male violence at home or are victims of sexual exploitation and trafficking. Women with precarious employment and risk of job losses. Women with disabilities and older women, and also female migrant workers who have limited or no access to services. Women with mental health issues such as anxiety and depression that are exacerbated in this current lockdown. Paraphrasing a European women organization, as many women are currently working in hospitals, providing essential care and cleaning services, or continue to work in retail, agriculture, domestic work, and manufacturing that enable the rest of the community to live in self-isolation, we are reminded about how invaluable women's care work is to the well-being and functioning of our society and planet. The European Union promotes the protection, fulfillment, and enjoyment of human rights by women and girls in all external actions. Overall evidence shows that when women are given equal opportunities and access to resources and to decision-making, communities are more prosperous and more peaceful. The European Union assists partners in effectively using this significant transformative potential. In addition, the European Union strongly believes that civil society organizations are crucial development partners, as they are the closest to the populations on the ground and thus best placed to know their needs. Today, you will have the opportunity to share insights, prospects for recovery and resilience building to help alleviating the economic impacts of COVID-19 on women. And I'm very grateful to be able to listen to you today. I wish you a fruitful discussion and session. Salamat.
Thank you so much, Stephanie. We truly appreciate EU's support to the program and its commitment to women's empowerment in the region and in the Philippines. Now moving on, we are really very fortunate to have with us Ms. Nanette Medvedpo. She's founder and director of Generation Hope and Friends of Hope Incorporated, which produces both company-branded and co-brand consumer goods. 100% of profits from the Hope line of products are used to provide opportunities for education and support smallholder farmers. A well-known philanthropist and entrepreneur who champions work for the most vulnerable, she was recognized as one of Forbes' Heroes of Philanthropy in 2017. And in the same year, Hope won the Grand Prize in Developmental Social Enterprise Awards by PricewaterhouseCoopers Philippines. Ladies and gentlemen, Ms. Nanette Medvedpo. Ms. Nanette.
Thank you. Good afternoon, everyone.
When I was asked to deliver a special message for today's session, I must admit I didn't know if I could muster the voice needed in this historic moment. But I quickly realize now, especially, that all of our voices matter. We're going through something unprecedented in modern times, a pandemic of global proportions that is bringing humanity to its knees, physically, economically, socially, politically, and making us all face the messages that come with our lack of foresight. COVID has exposed that we have failed. We have failed in our policies and in our politics to protect the most vulnerable among us with the social safety nets that would help them their incomes and families. A virus has shown us what our politics could not, that fundamentally we are all the same, that we are all connected regardless of race, religion, gender, geography, or economic status. It showed us that we have prioritized and built a world of excess in all the wrong things. And it has shown us that we've abused our home. So what now? Will we heed that message? Will we take the cue and use this opportunity to do better and to learn from the democratizing experience of a pandemic and reflect on the systemic changes that are needed to uplift ourselves as a species and to protect our planet? I often read that this virus will change us permanently. I certainly hope so. It's shown us that despite all the things that we claim divide us, that we are in fact capable of coming together to solve the great issues that threaten us. That truly, in the most basic ways, we are all in this together. For me to try and lay out any kind of action needed to overcome this crisis and emerge better is far beyond any 10-minute remarks I might make, and certainly well above my pay grade. But I dare say there is a framework for action. The UN's 2030 Agenda for Sustainable Development, with its 17 goals and 169 targets, is a great example of where we all might start to focus and find the right path forward. Given that framework, given the magnitude of the problem, the impending recession, and the burden of care that will be needed in all areas of society, one goal might be worth highlighting as a crucial place to begin. Goal number 5, with women and gender equality. I will not recite the data today that I'm sure you all know too well, but simply reinforce the larger takeaways. Women will suffer disproportionately in this crisis. We need look no further than the heroic front lines of this war that rely heavily on healthcare workers, 70% of which are women, and all of whom need to strike a balance and overcome their fears to perform their duties. Women are feeding their families, fending for their families, looking after children, becoming teachers at home as they themselves try to work from home. Many women will lose their source of livelihoods as informal workers and employees of small businesses that do not have the resources to keep their businesses open. Women will not be able to access important services and support and abuse, as well as those for reproductive health concerns. Women, when given the opportunity, contribute positively in all areas that they participate. We've all seen these studies. The McKinsey Global Institute suggests that equality for women might improve the global economy anywhere from $12 trillion to an ideal state of $28 trillion by 2025. That's a potential increase of 26% of global GDP in this critical time. Why not unleash that powerful potential of 50% of the population and try to bring forth the aspirations of all of our sustainable development goals? For those who will live through this pandemic, this is a time to muster all of our resources, not just some, to do better, to think greater, to unite and to learn. We are all affected. Any of us can test positive, lose our loved ones and our economic security all in one go. More than ever, we need international cooperation, not xenophobia, to address global issues. We need the private sector to bring their incredible resources of their trade to consider social good permanently in their goals, and not just when they feel a threat is imminent. We need governments to cooperate with the private sector to help coordinate and incentivize efforts that propel our mutual benefits forward. We need people to recognize that business as usual does not work. This is our wake-up call. We are right to be frightened, but we are also right to be optimistic. We have but to look around us on the front lines or in homes with doctors, nurses, chefs, grocery store employees, factory workers, truck drivers, janitors, teachers, priests, nuns, farmers, military, the police, government officials, and everyday civilians to see the proof of the better angels of our nature shining through. We are built for a challenge when we face it together. United by the knowledge that real strength isn't shown by pushing others down, but by lifting everyone up. This is my message of hope. Thank you.
Thank you very much, Ms. Nanette, for that message. Both unsettling but very inspiring as well. The call for unity and the call for everyone to find ways to lift each other up, I think, is what we want to know and what we want to take away as we finish this conversation. Now, we move to our panel discussion, which we have split into two. The first panel will cover and bring forward the perspectives and insights from different women's communities. And our second panel will talk about the prospects for recovery and how to build resilience amidst crises such as COVID-19. When we all know that it will not be business as usual for many of us after this lockdown. Let me introduce to you our first panel. Jeanette Dulawan is Gender Advisor of Oxfam Philippines, an international NGO at the front line of many humanitarian and emergency crisis situations globally and in the Philippines too. Ms. Elizabeth Angshoko is Chair of Democratic Socialist Women of the Philippines, a socialist feminist organization representing 242 accredited grassroots community and sector-based women's organizations. Ms. Maros Ramos is Deputy Director of Galang Philippines, a pioneer organization looking after the rights and welfare of lesbians, bisexuals, and transgenders through grassroots organizing and community building. Rochelle Agualin is Project Officer from COSE, Coalition of Services for the Elderly, focused with older persons in the Philippines to address their issues and rights. She's currently managing a project on financial security and other related concerns for elderly community. Lastly, Ms. Benta Clarin, Executive Director of Women's Legal and Human Rights Bureau, a feminist legal rights non-government organization which has worked to empower women through engagement with law and its institutions. It then expanded to providing legal services, legislative advocacy, and capacity building for women and key regional, national, and local government agencies. Now we give the floor to our first panel member, Jeanette.
Hi, good afternoon, everyone. This is Jeanette Kindipan Dulawan of Oxfam Philippines. So let me first present our assessment of the unfolding of the crisis that's COVID-19. As mentioned by our previous speaker as well, they have also presented the issues, impact of the COVID. In terms of our assessment of the unfolding of crisis, we have looked into the decreased access to food, wherein those who can afford were able to stock up on food. People with limited means have decreased access to food during the enhanced quarantine. The restricted mobility also due to the stoppage of mass public transportation systems led to decreased trade on food, a major source of income of the informal sector. The panic buying of food led to soaring of food prices, of which current purchasing of power, especially of those in the urban poor, daily income earners, and in the informal sector cannot cope with. It has also impacted on the food intake and nutrition, especially of the elderly and children in households where food is rationed. As in many crisis situations, women have socially circumscribed roles to make both ends meet, to absorb the decreased caloric intake or skip meals entirely. In relation now to the disrupted access of women and girls to sexual, reproductive health and rights, the community quarantine has also limited further the access of women and girls to SRH facilities and services, which were already scarce before the outbreak of COVID-19. Further disruption of access to SRH facilities will lead to unmet SRH needs, rise in the number of unplanned pregnancies and SRH complications. In addition, limited access to menstrual health, pre- and postnatal services due to limited mobility, conversion of gynecological facilities to make way for COVID-19 cases. Understandably, pregnant women fear going to health facilities due to the high risk of being infected with the virus. Disruption in access of pregnant women to including postnatal facilities could lead to pregnancy complications, including health of both mother and child, or even maternal mortality. There is also a need to heighten information drives on the vulnerabilities of pregnant women, as well as pregnancy health standards guidelines on COVID-19. In terms of loss in jobs and livelihoods, a significant number of women engaged in informal economic activities have ceased operations. Those who have been able to continue have had to grapple with disrupted supply lines and decreased demand. Businesses continue to announce the halting of their operations, including airlines, food and manufacturing industries, department stores of where most women are employed. Halting of business operations will result to massive layoffs, loss in jobs. Female-headed households, especially solo parents in poor communities, will lose their jobs due to massive layoffs, will suffer the most. As in many crises in the past, some will cope with the crisis by borrowing money from informal lenders who charge odious interest rates. Some will even resort to engaging in transactional sex for food, of which mostly women and girls are the ones involved, especially when accessing food for households is mostly relegated to women. There's also an increasing time spent on unpaid care work of women and girls. Oxfam's recent findings on unpaid care and domestic work show that women in the Philippines are twice as much more likely to shoulder household tasks, such as childcare, which are compounded by expectations that they will now be the primary carers for the sick or for those under quarantine in the absence of enough hospital beds, test kits, access to critical medical services, and other social safety nets. There's also the unmet needs of women healthcare workers. According to the World Health Organization, 70% of the world's health workers are women. They are now in the front lines of the pandemic, challenged by the shortage of resources and protective equipment to keep them safe. The severe scarcity of PPEs, exacerbated by unconscionable hoarding of medical supplies and equipment by private individuals and organizations intended for frontliners, increase the risk of exposure of frontline workers. The UNFPA also reported that other than PPEs, menstrual hygiene needs of women frontliners are not being met. In addition, there is still hello?
Yeah, Jeanette, please advise me if I will go to the next slide.
Yes, of course. There's still a need to determine if women frontliner workers are provided with the necessary hazard pay, social protection, and medical insurance. There is now the increased incidence of GBV and VAUSI. Based on experiences, heightened tensions in households may escalate and crisis due to financial, food, and health insecurities of the household. Based on experiences in Wuhan lockdown and the Ebola crisis, most of the victims are women and girls. Also, women in abusive relationships have limited or no access to safety facilities and are quarantined at home with their abusers, thus increasing the chances of escalated violence, GBV facilities may also cease to operate. Referral pathways that have been in place are disrupted or not effective due to lack of absence of competent personnel who are also part of the community quarantine. We also looked into the implications to emergency and humanitarian responses. Health emergencies might also cause development and relief actors to post-wash projects, depleting already scarce resources. In such situations, women and girls often find that their access to hygiene and sanitary materials is reduced due to decreased household income or increased household competition for scarce hygiene resources, impeding their ability to conduct household-level disease prevention efforts or to attend to their own hygienic needs. Women and girls who are reliant on humanitarian agencies for their sanitary supplies, including menstrual hygiene goods, soap, and water treatment tubs, may find these services interrupted. Next, please.
Jeanette, you have 2 minutes to finish up your presentation, please.
Okay. So,
Are we showing the right
yes.
slide? Okay.
Yeah. From the effects of the unfolding crisis, Oxfam Philippines also categorized its response plan strategies in 4 thematic areas as it aims to contribute also to broader efforts by government and CSOs to contain the spread of the disease and mitigate the social and economic impact of the poor through a combination of approaches that target people in poverty with specific focus on women and with conscious and intentional gendered context in the other 3 thematic areas of focus. These are the access to accurate and timely information, of course, public health and water sanitation and hygiene, emergency food security and vulnerable livelihoods, and gender and protection. In terms of access to accurate and timely information, there is a need for accurate information and enhanced community quarantine and resulting restrictions, need for heightened and accurate information dissemination on vulnerabilities of pregnant women. Delivery of the above information needs to be thought through and done creatively considering the challenge of enhanced community quarantine. There is also a need for proactive community engagement in terms of dissemination and exchange of accurate and timely information with one another. There is also a need for information drive on livelihood employment opportunities, especially for those whose livelihood employment were discontinued. In terms of
I need you to wrap up, Jeanette, soon.
Yes,
Yeah.
okay.
Thank you.
There's a need to establish risk communications with key messages focusing on the importance of hygiene promotion, explore days of rolling stores that could deliver or transport essential wash items in barangays, explore days of local transport providers, and explore possibilities of distribution of hygiene items through barangay volunteers. There's also a need to support barangays in constructing temporary hand washing stations and training of partners on COVID-19 programming, focusing on gendered health and hygiene messaging. In terms of EFSVL, establishing SOPs on cash programming for COVID for lobbying to LGUs to encourage some mobility on particular areas, risk communication with key messages focusing on social protection measures to be done by government and how to claim these once in place. Explore days of rolling stores that could deliver or transport essential food and non-food items with local stores so targeted community can access through vouchers. Engage the private sector to support with MIMOs with limited resources and explore alternative livelihoods related to PPEs that may generate employment. In terms of emergency employment, there's a need to look into conditional to work or care work, and in-kind aid coupled with support to transport groups, essential food items linked with small businesses and or other supermarkets. In terms of gender and protection, there's a need to advocate or communicate the inclusion of the provision of sexual and reproductive health services by LGUs or responders during distribution of basic goods to communities. Augment the financial capacities of LGUs providing mobile health clinics to include provision of pre- and postnatal care checkup for those who urgently need it. Supplement financial capacities of responders in providing needs of female frontliners.
Yes, thank you, Jeanette. I think we need to really wrap up
Okay.
your presentation.
Okay.
And would you be
Let me-
able to share the slides to us so we can send it to everyone who's attended?
Okay. Yes.
Thank you. Any final words, last 2 sentences from your end, please?
Okay. Let me go back to the pro-poor, pro-women approach to COVID-19, ideas for pro-poor and pro-women approach as presented by Lan Mercado of the Oxfam International Secretariat. These are in terms of social protection measures, gender and protection, working with business, information campaigns, and public health measures.
Yes, thank you so much. We have noted that. Thank you, Jeanette. Now we have, maybe call on Ms. Beth Angshoko from the DSWP.
Hello, good afternoon, everybody, and thank you to UN Women, especially Len, for doing this very timely discussion or conversation. My presentation today is entitled Filipino Women and COVID-19, Continued Invisibility and Vulnerability. Actually, I was toying on the idea of whether I will use continued or increased because of the crisis that we're facing now. Next, please. When we say that we would want to help or we want to draft initiatives to address women's needs in the time of, meaning now and post-COVID-19 era, some of the ideas that we have discussed, and I'm coming from more than 30 years of experience as a women's rights activist and as a feminist, and concretely working with communities, the most vulnerable of women. Any initiative to help women must first determine women's situation from the women's point of view. Especially, and I would say that this is most important, especially the disadvantaged women. These are the poor, those in unequal relationships, lesbians, bisexuals and transgenders, the elderly, the youth, the solo mothers, indigenous women, differently abled women, unemployed or underemployed women, and others. These women actually should be the focus of intervention. Secondly, any intervention must be conscious of women's vulnerabilities pre-COVID-19. This means that we must be aware of what of the situation of many of our sisters, particularly in poor areas, as they go about their daily lives. For instance, the care, the unpaid care role that's played by women as family caregivers. The invisibility that's not just now, but has been ongoing in terms of making decisions for women, in terms of crafting of responses to crises like COVID-19, the vulnerability to abuse and violence, reproductive health-related concerns, and others. These vulnerabilities actually, in the time of COVID-19, has not improved, of course, as already pointed out by our previous speakers. In fact, the situation most probably, I'm not saying for sure because there is a need to really talk to women about this, most probably has gone worse. The third is that we should be informed by how COVID-19 is changing or has changed women's situation. It's been said that most vulnerable perhaps would be those who depend on daily wages, those who are working in informal economy. Have they lost their job opportunities or their livelihood opportunities? Do they still have money to go on doing their sari-sari stores? Did they get sick, or did somebody in their family get sick? Have they lost a loved one, and how did this impact on them? Was there an unplanned or unwanted pregnancy, including teenage pregnancy? Was there heightened abuse or violence? Because it's very different when you cannot go out and you live with your possible abuser. No, so we must look into this. Lastly, any intervention on women should address both the practical. Go back, please.
Sorry.
yeah, should address both the practical and strategic needs of women. What do I mean by the practical and strategic needs? These are the present needs. The practical needs are the present needs. No food security, medicine, shelter, water, electricity. These have been mentioned by our speakers before me. And then we must also look into the needs that will help women advance or help women restart their lives. This can be in the form of employment and livelihood opportunities, education opportunities, social protection, protective laws, and other things. Next slide, please. And just to reiterate what has been said already, presently the interventions are actually blind to women's needs because we are lumped with all others. Nothing is done in terms of determining what the specific needs of women are, and therefore the responses are uniform. For instance, there has been no news virtually of government, and I refer to government interventions. There has been no news in terms of distribution of hygiene kits, which women need. There is no plan in making women who do family planning be able to meet their needs. There is no plan for pregnant women so they can, go through their checkups, have their access to vitamins and other things. So basically, women are missing in the interventions that are being done or are being planned by government now. In the other thing is that it's more focused on police and military presence. COVID-19 is a medical problem. COVID-19 has to do with the social lives, the family lives of people. Yet government tend to focus more on the police and military aspects of the responses. The response is uncoordinated, fragmented, and severely lacking. I've heard from reports of women in our communities that it's not even true that they are reached by the so-called help being brandished by government. Some LGUs are doing fine, and which means that which is a proof of the plan or the interventions being uncoordinated and fragmented. Some LGUs are not doing good at all. Lastly, these interventions, these plans are prone to corruption and abuse by those in positions of power. We have seen, for instance, how the DOH, how our health department has been very largely dependent on contributions in terms of the PPEs that they distribute to our health workers. We have seen, we have had reports of women being abused in checkpoints of all places, in checkpoints. And who are the abusers? The women are saying that it's the police. So these things are happening now. Next, please. Next slide.
Beth, last 2 minutes to wrap up,
Yeah.
please. Thank you.
Yeah, thank you. So moving forward, whenever possible, development agencies should now, at this point, prioritize addressing women's specific needs as the COVID-19 pandemic continues. Because if we will not address this, no one will. At the rate that the official plans are being drafted and are being implemented, I don't think that we can depend on government at this point to deliver the needs of women. Post-COVID-19, Philippine women's groups, I hope with support from development partners, can come up with a framework for consultations with marginalized and vulnerable women for needs determination. This is quite important because we might be coming from a very rich experience in terms of women, but this is something new. We cannot second guess what happened to the women in the communities, and therefore we must exert all efforts to reach them and converse with them and make their voices louder, amplify their voices so that this can reach the decision makers. And then, secondly, post-COVID, next slide, please. For development organizations to again put women at the center of the development agenda and come up with programs that, one, address women's practical and strategic needs, as already said earlier, support the reconsolidation and strengthening of Philippine feminist groups, particularly because of the kind of challenges that we're facing in the Philippines now. And lastly, support advocacy for the fulfillment of women's rights. This is the time to put women at the center again, because for so long, women has been lumped with all other development programs. And I think COVID has shown us, COVID-19 has shown us that it is time to again put women at the center. I think that's all, and my last call would be, at this point, let's all stay negative. Thank you.
Thank you so much, Beth. Now we move on to Maros.
Okay. Hi, good afternoon, everyone. Basically, almost all of my presentation has been mentioned by Beth and Janet already earlier. So I'll just go around, give a run through of what we've documented so far in our partner communities in urban poor areas within Quezon City, given that it's also one of the cities that has quite high
Yeah.
number of positive deaths and low recoveries. So our majority of our partner organizations belong to the urban poor communities, and including those that's under extreme enhanced community quarantine right now. It meaning there are more than 2 positive documented cases of persons living with COVID-19. So they fear acquiring the virus itself, given the congested community they live in. Most of our partner members of our partner organizations also are minimum wage earners, so they're service crews, rank and file employees, or have small scale businesses like sari-sari stores, pedicab, or tricycle drivers. Due to the crisis and the lockdown, most of them are not able to go to their workplace since there's no public transportation and of the diverse policies in the checkpoints. Hence, they have no earnings due to the no work, no pay policy in their respective communities. For some, their companies were forced also to temporarily close due to the lockdown and employees were not paid. So for the past 2 weeks or for the past 3 weeks, I think, majority of those who are working had to make a do with their last salary, which is not enough, basically. And again, as minimum wage earners or belonging to the informal sector, most of them rely primarily on the government's assistance to survive during this lockdown, which they barely or do not have access to. And then there's the limited visibility and access to LGU officials and services. People could not reach their LGU officials. I think there's in quarantine also due to the lockdown. There's a lack of access to or unavailability of the aids or assistance from the LGUs in relation to the current crisis. And then they have this, of course, given that they're from the vulnerable sector, the marginalized sector, mental health issues are very evident. And of course, the negative emotions resulting from having no means to actually just buy your food. Before the lockdown, some of them have already experienced discrimination and violence from their families or relatives because of their sexuality. Uh, it was only when they were able to provide for their families or give financial support that they were somehow better treated by their families. Now, with the current crisis, economic instability, limited or no resources, some of the stressors could also lead to gender-based violence. So I'd just like to mention a few cases that we were also able to document. So during the initial stage of relief distribution, most LGBT households or LGBT couples were not included because they were told that they do not fall under the family category, meaning they supposedly the only beneficiaries are heterosexual couples with a child or children. So even those heterosexual couples were not also without a child were not also included as beneficiaries, or for those solo parents where in their child's name do not match their own surname, they were not also included as beneficiaries. um, some also have not received relief goods because their barangays told them that they ran out of supplies, uh, which we're not really sure if it's true. And then there's also the case of one unit is already considered just one household, when even though there are two or more households within the same unit. Given this is an urban poor community, urban poor setting, they were initially not included in the beneficiaries also. And then another person or another LBT within the urban poor community was not given again assistance because the address reflected in her ID does not match where she resides now. Another is a one LBT member of our community in the community is the primary caregiver of their elderly and sick parent, who has also that LBT has also lost source of income given this lockdown because of this lockdown. So they do not have means to buy medicines or even go to their to her parents to that parent's doctor. And there's one case wherein the person living with COVID-19 resides a few houses away from several of our members of our partner organizations. And actually, I think this is one of the cases that was asked to go home because they have mild symptoms. So currently, that person is under in home quarantine and being monitored by the Barangay Health Unit. On a lighter or positive note, there have been several barangay councilors or kagawads who, since there are no food packs they could distribute, they gave they gave cooked food in lieu of the food packs. In terms of coping mechanism, currently what we're doing now is just continuous communication with our partner organizations, since we cannot go there physically. And as much as possible, we try to remain up to date. So no fake news, up to date on the,
Last
yes,
minutes to wrap up,
okay,
please.
sure. On the
Thank you.
programs and services and assistance of the local governments in relation to the crisis, and of course on how to make better delivery of this assistance. Just actually, it's not suggestion but more of question: how can we make our social protection policies be gender inclusive given it's not gender inclusive in the first place? How can we make monitoring documentation of actual gender-based violence cases during this lockdown and crisis be more gender inclusive and real, so that we have the true numbers and true real narratives of the women LBTs in the communities? And how do we connect the communities with other people and organizations that would actually provide help, not just the financial but also in terms of mental health issues? So
Okay.
basically, and that's it. Thank you.
Thank you so much, Maros. We have two last speakers for our first panel, but may I just request Rochelle and Jelen, I know you've prepared a PowerPoint as well, but if you could skip over the points and the highlights that was shared already by our past speakers, we would greatly appreciate that. Can we now hear from Rochelle, please? Rochelle?
Yes, good afternoon, everyone. I'm Rochelle Godin from the Coalition of Services of the Elderly. And today I'm going to give you a short background of the situation of older women or older persons in general in the Philippines in the middle of COVID-19 crisis. And as of March 30, there are 604 or 39% of the confirmed cases of COVID-19 are older persons. And of the 78 recorded deaths, 57 are older persons or 24% are older women. And 4 in 5 reported deaths are older persons. Next. Of course, COVID-19 has negative impacts on older persons' health who are at more risk of getting infected because of their weakened immune system. 73% of the 78 fatalities are 60 years old and above, which means that older persons are not only susceptible to coronaviruses, but at higher risk for severe diseases and death. The UN World Population Prospects 2019 says that in 2019, women comprise 55% of those aged 65 years or over, or women outlive men. While the data shows that of the reported death on COVID-19, 50% are older men compared to the 24% of older women, the latter will likely to live in poverty in older life. And data from the Aging and Health Population in the Philippines 2019 shows that 1 in 5 older persons have an unmet need for medical care because of financial reasons. This is before COVID-19 data. With the current crisis where older persons' economic activities are disrupted, the 3.8 million indigent senior citizens are probably suffering more. Poor health condition and no or limited access to medical and health services. Next. Let's move to the impact of COVID-19 to the socioeconomic. For the older persons who's into jobs that do not even guarantee a good and stable job or income, a day without an earning makes older women and daily wagers' lives more impoverished that could lead in depression and poorer health conditions. Data, again from the Aging and Health in the Philippines 2019, shows that nearly half or 47% of the older persons provided for financial assistance to any of their co-resident children. On the other hand, data from the same study shows that more mothers or older women, which 70% receive monetary support from their co-resident children. And for older persons, particularly amongst women and those in the older age group of 7 or 80 and above, the second most common sources of income is money from children in the country, meaning most older women are depending on their children for financial support. But what will happen to them, especially to the older women relying on their children, when their children's lives are also affected with the crisis? For their children who belongs to the no work, no pay scheme, who will provide for their needs? Next. We've seen many efforts from the government in different interventions or measures being implemented by local government units in addressing the issues on COVID-19. Number one is older persons as well as the pregnant women and individuals with underlying medical conditions showing symptoms, even if it is just mild to moderate, are priority in the testing for COVID-19. Second, making programs and services more accessible. Example here is the famous mobile palengke in Pasig, which is now being replicated in other LGUs. Third, providing temporary shelter for the homeless. Fourth, distribution of food and hygiene packs. And 5, the social amelioration program of the Department of Social Welfare and Development. Next. While different efforts are continuously being done by LGUs, there are still gaps in addressing today's crisis. And COSI, of course, want to know where exactly are the older persons in the government plans against COVID-19. Older persons suffer discrimination. Day after the enhanced community quarantine was declared on March 16, a 69-year-old street dweller was arrested for violating the curfew. She was found sleeping on the street and was also charged with oral defamation for cursing the barangay tanod who woke her up at 1 o'clock a.m. Gladly, this older woman is now out of the detention cell. Second, another is a story posted and shared in social media of an older person who was caught by police officers for selling carton despite the quarantine. He has spent actually 3 hours in a covered court in Quezon City as retribution for what he did. He still worked knowing it is against the law because he needs money to buy food for his family. And second, older persons suffer exclusion and social isolation. We've heard actually stories or complaints of older persons not allowed to enter grocery stores or supermarkets or when to just get home. but for older women and living alone who will purchase their daily needs and medicines. The Trade Secretary already said that senior citizens are allowed to go to groceries and supermarkets and encourages establishment to designate a senior-only shopping hour. However, this is not implemented well as many older persons are still waiting on queue, staying longer hours outside their home and exposing themselves more on possible viruses. And third, the delayed payment of social pension benefit. This is actually the time that the older persons need the social pension benefit the most. Next.
Rochelle,
COSEP, yes po.
please. A minute to wrap up.
Okay.
1 minute, please.
Okay.
Thank you.
Okay. COSE is calling for the DSWD to release immediately the social pension for indigent senior citizens. For 2019, there are more than 900 social pension beneficiaries who are still unpaid as of March 2020, and of course, the immediate release of the social pension for the first semester of 2020. Second, inclusion of older persons in the emergency cash assistance and making sure that older women living alone are included in the social amelioration program. And third, review the current plans and measures against COVID-19 to develop an older person's inclusive measures or included in the triage protocols for COVID-19 by consulting older persons representatives and coordinating with organizations working with and for the older persons. And number four, regular monitoring of older persons. And of course, COSE believes that the safety of older women and older persons in general is everyone's concern, yet the government is accountable in ensuring the welfare and well-being as members of the society. And I want to end my presentation by saying that without a specific and inclusive measures for older women and older persons in general, we are slowly putting their lives on the edge. Thank you and good afternoon, everyone.
Thank you so much, Rochelle. For our last speaker, can we hear from Jelen Paclari from the Women's Legal and Human Rights Bureau?
Yeah, thank you very much, Lenden, and thank you to UN Women for organizing this event. My presentation is entitled Understanding COVID-19 from a Women's Human Rights Perspective. So next slide, please. Before I proceed with the issues, by the way, I would just like to acknowledge that my presentation for today, or WLB's presentation for today, are based on the updates of WLB community partners from Marabot Samar, Cabangan, Zambales, Talisay, Negros Occidental, and from province of Quezon, representing Real, Nakar, and Infanta. But I would like to start first with what have been earlier articulated. Who are the women? By identifying who are the women, where are the women? And I think there's a clear example if we refer to the 2016, to the post-Haiyan, to the Haiyan experience, which was also reiterated by WLB in its research in 2016. Most women, the crisis that we are in now cannot be gender blind, and therefore we cannot say that it's a gender neutral phenomenon. The same as disaster. COVID-19 is not a gender neutral phenomenon because we have to look at the context, experiences, distinct issues and experiences of women, including its implication to women. We cannot talk of this crisis blindly, because most women are in the education, informal economy, factories, manufacturing, service sector, farmers, fishers, ITs, and in addition, the different identities and identities that they represent too. One of the common issues that has been raised or problematized during this time is what has been also circulated in most literature, that women bear the mental load. And now, because of this crisis, it's the pre-existing mental load and now the mental load of COVID-19. What do I mean? What do we mean by mental load as articulated by women from the communities? It's about household chores. It makes it more difficult because of restriction now, because of the enhanced community quarantine. No? Second, the management of the house, taking care of the bored children, what the children will do because they cannot go out. The lack of income and the survival of the family. These are in additional mental load that also affect the mental wellness of the women right now, which in a way are invisible or are not being discussed. And then I would also like to reiterate that we have to differentiate the urban and rural context. No? Although most of maybe the examples cited are urban context, we will focus more on the rural context because WLB's partner communities are in the rural context. And at the end of this COVID-19, we are hoping that development groups, development donors will not go business as usual. I hope that we will not focus on what are we supposed to deliver, what we're supposed to be put in the log frame, but we have to look into the real problem, poverty, hunger, and survival. So we cannot talk of economic rights, although this is an economic program, without looking at social political rights and experiences of women. And therefore, they are interlinked and interconnected, and we cannot just say that we can focus on economic rights. Next slide, please. So what are the issues that has been raised by our community partners? So one is the lack of information because of the enhanced community quarantine. There is limited or no services provided by their local government. So it would appear that there is no food, no relief, or if there's relief, they're not sure if they will receive relief after 1 week or after 2 weeks. There is a particular government community that says that the entire government is in quarantine. So what do we mean if the entire government is in quarantine? What will the citizens will do? And then the particular area is there are some stranded migrant workers. Who will address the stranded migrant workers in that particular area, given that the government are in quarantine? Second issue is the survival issues. Whether they are going to get relief, whether if they will they have money, where they can they buy food, where can they borrow money if they don't have money, or if they have money, what to eat, when they will eat, how they will pay the money that they will borrow. These are some of the everyday issues that keeps on coming, and text messages that we receive from our community partners. And we really feel bad because we cannot even help them. We cannot even support them because we're talking of money. No, and it's very shameful that a particular senator even said that money is not important now. It is important now because we're talking of survival. Second is multiple burden. Multiple burden has a different view now, no? Because they have their own products at the rural area. So this particular product that I will refer is the coconut, no, farmers. So because they cannot sell their coconut outside of their rural area, so they have to develop their products into something else and sell it at a lower price because they have to survive. They need money to buy food, no? They are forced to sell their products at a very low cost, which is not even enough to pay for their loans, no? So again, after this COVID, how they will pay for their loans? How they will survive? They might survive COVID, but after COVID, what are we going to do, no? And now they are forced to sell goods at a very low cost to their neighbors because their neighbors also has to survive. They also need to support their neighbors. Next slide.
Last slide, Jean.
Yeah. The next issue is if they have money, will they buy food versus personal hygiene expenses? So these are some experiences of the Aita women and the women farmers in Quezon. Will they buy rice instead of alcohol or soap, or will they buy let's say root crops instead of buying other hygiene kits, no, or necessary hygiene kits? And we've asked them if they have received any hygiene kits, no, in their community. So none. And most of the supplies, if there are supplies from the barangay level, it's only good for the first weeks. So most of them are really crying for help, asking for support because their barangay, their local government can no longer provide money and support after the first 2 weeks. And I'm talking of first 2 weeks ending end of March. Women leaders I saw one comment, and I think maybe this is an answer. Women leaders also, because they are being active doing work as are tasked to address gender-based violence. Now they're also tasked as frontliners at the barangay level to address COVID-19 with limited support for the government, no? So why are they accepting this job? Because they need some allowance. They need money to survive. So even if they have to expose themselves, they will accept the job. Not because they wanted to be heroes, they wanted to die, but because they really wanted to support, no, support the needs. Can you still hear me? Because it says I'm unstable internet. Yes.
Yes, we can hear you well. Thank you.
Okay. So women leaders are also tasked to monitor the arrival of OFWs in their area, but there are no PPEs being provided to them. So they are only provided with surgical masks, but that's it, no? And then some barangay VAO desk before are now tasked as barangay health emergency response team for COVID-19 at the local level. Again, there's minimal or there's no support in terms of how they can protect themselves. And I'm talking of all women leaders doing work at the community to address gender-based violence. There are also some peasant women leaders who are in the front line and in charge of the checkpoints. No? Imagine peasant women in charge of the checkpoints because they are known leaders in the community and implementing quarantine protocols because they also act as barangay health workers or barangay tanods, again without proper PPEs. These are happening in areas of Quezon, Samar, and Samar. So accessibility of services and facilities is a problem. No? It's a problematic. But when we speak of physical distance, we're not just talking of rural context. We're also talking of women migrant workers being unable to access services, no, because of their citizenship or nationality if they are, let's say, in another country. When we speak of accessibility, we also have to look into the lactating and nursing mothers. They have different needs and different concerns. The same with pregnant women and women with disability. And I think these are important issues that has to be raised now because when we speak of women, these are particular contexts that only women can experience. Lactating, nursing mother, pregnant women. Men cannot do that, no? So there are extreme vulnerability because of this extreme context of women. And then now, based on WLB's cases and even among the communities, there is low or no reported cases of violence against women. Some women and even men refuse to accept contraceptives from barangay health workers. They said they don't want to accept. And I think this is problematic. Problematic because it, as earlier mentioned, it could contribute to a lot of pregnancy after COVID. Violence still occur because there's no food. Marital rape happens because women are so tired and busy with managing the homes, as I've said earlier, but their husband would want to have sex. So women succumb to giving in, but at the same time, it's for them it's violent. So women said, mamamatay kami sa gutom, hindi sa COVID. And we all know that. We will die because of COVID. Sa kanang usaping abuso, COVID muna. We can address the abuse later, but we need to address COVID now. So now I think the problem is if violence against women also are not being seen as an important issue along with COVID-19, women may suffer compounded. Women may suffer. Women will suffer and will have a problem, and we will know if they will still live after COVID because of this problem. So what can we do? Now they need money. They need
Jolene,
food.
1 minute to wrap up, please.
Yes, I'm already finished.
Thank you.
They need money. They need food now. They need hygiene kits to survive. They need the government that will respond to their needs now. Or else, I have said, they will die. So what we can do as an NGO, we can disseminate information so that it's more understandable to the public, to our partner communities in Tagalog. Or in Filipino, and then maybe we can document cases, stories, and eventually make the government accountable, especially during election time, because I think we cannot just allow this to happen. This is a culture of impunity. Thank you very much.
Thank you so much, Jolene, and thank you to all of our panel members who have shared the really key insights, stories, and life experiences of those who are in the community affected by COVID-19. We have very limited time for open discussion or open forum. I have seen that there are several questions posted, and I encourage panel members to address the questions directly on the chat box, just so we can highlight key questions that we would want to really hear from our panel members. I'll post the 2 questions already just to get the conversation started, and I would really request our panel members to be as focused and as much as possible short and sweet in responding to the questions. First, there really has been a lot of shared experience among the different groups and sectors of women. But what we want to hear are key action points that you think are very, very crucial that needs to happen now so we don't miss out on helping and supporting women rise above this COVID situation? And next question is there anything positive you see coming out of this crisis for women? Maybe in terms of different opportunities or development and representation moving forward when all of these things are beyond us. Who would want to go first? And silence.
Please raise your hands so I can unmute you.
Okay, the question is, what do we do now while COVID
Yes.
is happening? And
Yes.
also, what can we do in the future?
Yes.
For now, since I think everybody said that we all have limited mobility and we can do very little things, one thing I think that we can do is to make government accountable now through social media. I think that since we all have time on our hands, more than the usual amount of time that we have on a daily basis, we can use social media as our platform to actually raise the issues on women and try to make government accountable in terms of the interventions that are really short-sighted, that really do not recognize or even think about the situation of women. That's one thing that we can do now. And also another thing is that even with limited mobility, I think that development partners that are now allowed to go and provide assistance to people can focus on providing the assistance that women need now. For instance, what they need to be able to survive, as Jelen put it, or else we all die. So one thing is that food, money, and hygiene kits, family planning supplies, these are needed now, especially by those women who are supposed to be on family planning. We don't want to have a baby boom, especially if these are unwanted pregnancies 9 months from now. Okay, that's one thing. Second, in the future, I think that is very important to go back to the women as soon as we can, to determine what changed, to determine how COVID-19 impacted them, and to determine how they want, what they need, and how they want to be helped. I think it's crucial. Enough of those, coming from above development assistance, and then we'll just dump it on women. Enough of those, please. And of course, as I said, we can have, I think this is a good time to focus on women again. And I speak in relation with development partners. This is a time that shows us the vulnerabilities, but also the importance of women's actions at times like this, because women are the frontliners, as already emphasized again and again. A lot of the doctors, many of the doctors who are dying are women, actually. And many of our frontliners in hospitals, the nurses, are women. And therefore, this is the time, that's another thing that can be done now. Assist the frontliners, provide them with what they need. The PPEs, the masks, and everything. They need this to be able to do their job. A lot of our frontliners, health workers, are doing their jobs without protection. Imagine motorcycle helmets being used as protective gear. trash bags being wrapped around the body as protective coat, that's unacceptable. As one doctor said, they no longer have the dignity while they try to save lives. Thank you.
Thank you, Beth. Can we hear from the other speakers, please? Something that, of course, we hope would not touch on Beth's points, but also raise other response to the question posted. Thank you.
Hello. Can I go first?
Yes,
Also,
please.
next to Miss Beth. What we can do now is I would like to also share what Oxfam now is doing in partnership with also our in partnership with our previous partners. I think it is very important to look into and to continue with setting up platform for dialogues wherein there are to coordinate among different groups in order to enable also to have better scoping, coordination, and identification of gaps and needs, including what Ms. Beth presented a while ago in terms of immediate needs, and to look also into a partnership with digital financial inclusion partners as what Oxfam did in terms of partnering with Paymaya, launching of Paymaya, one against COVID-19, and spotlighting local humanitarian leadership in social media posts in relation to COVID, and of course, pro poor and pro women messaging, where we can put in key messages integrated in social media engagements, including social media posts, collateral developments, and of course, looking into recorded health and hygiene promotion messages, especially for those who do not have access to social media. And then the signing of risk communication flyers, especially for LGUs. That's it. Thank you very much.
Thank you so much for sharing with us your key action points at the moment for Oxfam. I think this is something that other well-resourced organizations could also emulate or demand from their government units or offices. Any other response we can hear from our first panel before we wrap up the first panel discussion?
Len, if I may.
Yes, please.
Yes. Again, this is more for development aid, no, organizations. I think what development organizations can do right now is, given that most of the data are coming from the community on the ground, I think the focus of grants or support should be for the communities. And maybe because we are gathering data from them, maybe we can also give them allowance or pay them, because what actually captures or represent how women, what we are doing on the ground is basically from the stories of women from the ground. But they're not receiving anything, no? They're not getting anything from development aid groups. And maybe that's something that can be included in the agenda, no? I know maybe because this is not the business as usual, so maybe we can get away with the usual proposal writing and so on and so forth. Maybe development aid groups can do something about this and really act on it and really address hunger, which we receive every day, and text messages, no? Second, I would like to reiterate my point in terms of documenting, no? Documenting cases. I feel very bad because it's difficult to file cases right now. It's really difficult because of mobility issue. But it does not mean that we cannot access justice after this. So what happened, let's say, because I saw Chang's point in terms of the sexual harassment that happened in checkpoints, the rude misogynist statement by Tulfo, and then other sexual violence happening. I think we have to act on it post-COVID. But we will never forget. We should not forget it. And we make government and private actors accountable because of their act during COVID. I think that's something that we have to do now. No? We need to document. And if the environment allows us, then that's the time that we will file cases against these people. Thank you.
Thank you so much, Jalen. Is there any other points we could hear from panel one? Else we would want to close the discussion. with our first panel and move to the next conversation. Okay. Thank you so much to our first panel members. You have provided us really the preview to women's situation in your respective communities. I think what's take away from the first discussion is the crucial prioritization and identification of the important needs that we need to address and we need to provide for women frontliners and women at the communities. At the same time, the value of having very truthful and right information to be made available to them. Outside that is the key need to document all of the different situation and all of the different stories, because post-COVID, there would always be a chance for us to tackle this and make very key specific agencies and stakeholders accountable. Now, moving on to our second panel. Well, before we move to our second panel, we are very pleased to have with us the Director of UP Center for Women and Gender Studies, also a faculty of the Women and Development Studies from the UP College of Social Work and Community Development. She will situate for us the impacts of COVID-19 on women based on key data and studies. May I now call on Dr. Nathalie Africa Verceles. Natsi, please.
Yes, so thank you for inviting me to join this webinar. So I'll flash my presentation.
Yes, please. Thank you.
Is it okay? Can everyone see it? Okay. So I'd like to set the context by showing some statistics. According to the latest Family Income and Expenditure Survey of the Philippine Statistics Authority for 2018, there are 24.8 million Filipino families, 65% of which, that's 16.1 million, have incomes 20,000 pesos and below. These are the families that are most vulnerable to disruptions on mobility and income generating activities. Now, I also have data from the April 2009 labor force statistics of the Philippine Statistics Authority. So there were, in April 2019, 16.29 employed women. And I also looked at the breakdown in terms of major occupation groups, nature of employment, major industry group, and class of workers. So just we have an idea where the women are. So 8.3 million are service and sales workers and in elementary occupations. 2.9 million are in short-term or seasonal and unpaid work. 288,000 for work for different employers on a day-to-day or week-to-week basis. And 5.3 million are in the wholesale and retail trade. 2.2 million are in agricultural, hunting, and forestry, and 1.9 million are in other service activities. In terms of class of worker, 6.6 million are in the informal sector. Ebon's latest estimate is that 14.5 million Luzon-based workers and informal workers are going to be dislocated in varying degrees by the lockdown. Most of these are vendors, shopkeepers, and salespersons in the wholesale and retail trade subsector. Also affected will be construction workers, workers in the transport sector, which include pedicab, tricycle, jeepney and truck drivers, and mechanics, manufacturing workers, and hotel and restaurant employees. Of the aforementioned, the wholesale and retail trade and hotel and restaurant subsectors are female-dominated. NEDA predicts a considerable slowdown in tourism, and this will affect many women workers in this sector. Also, according to Ebon, the second wave of displacement in the Visayas and Mindanao regions will add to this. Assuming less restrictive measures than the Luzon lockdown, the initial estimates are that another 4.4 million workers and informal workers are going to be dislocated. Most of these are in these sectors. So in thinking about the immediate economic impacts of the COVID-19 situation on women, I will begin with women's reproductive work, or the multitudinous forms of care and maintenance work that women perform in households, in which we all know they bear the disproportionate burden off. This work, despite its economic and social value, is persistently unrecognized. In low-income households, we imagine the intensification of women's reproductive burdens because of the additional care responsibilities for family members who might be hit by the COVID-19 virus. With schools closed, they also have to look after their children for longer hours. With diminished or no family income, they are encumbered by ensuring that there is food on the table and that other basic needs are met. They do not have the financial resources to stockpile or to panic buy, nor the ability to pay higher prices for basic commodities when increased demand or supply disruptions result in a surge in prices. We also consider how more devastating the economic impacts will be for the lowest income, female-headed households. We surmise that for many women in the informal sector, the impacts of the COVID-19 pandemic were already felt. This is a sector where there is no income security, safety nets, and health insurance to begin with. There will be a decimation in the earnings of those affected by the economic slowdown, social distancing, and quarantine. These are women who sell goods in the streets or in public places or from door to door, and who provide services such as cleaning, laundry, etc. Women are overrepresented in flexible employment. So these are casual, temporary, contractual, and part-time work. Pre-COVID-19, these are forms of employment already characterized by insecurity, low income, poor and exploitative working conditions, and limited or no social security and benefits. If these women are paid only when they work, how are they getting by? Will they be able to return to their jobs, or will they lose their jobs as firms downsize or shut down as a result of the crisis? In industries where employment is female dominated, so these are education, services, health, social work, retail trade, accommodation, and food service, we interrogate how women employees are being supported and assisted by their employers. Large firms such as Cebu Pacific, JG Summit, Jollibee, Ayala Corporation, and the MVP group of companies have taken steps to protect their workers. But 99.6% of all registered businesses are small and medium enterprises, which employ over 70% of the workforce. How many SMEs can afford to do the same and for an extended period if the containment measures extend beyond April 14? In the public sector, I'm assuming that all employees are still receiving their salaries as we are currently in UP. And in UP, this includes even those who are on contractual or under a job order arrangement. NEDA predicts a 5 to 10% decline in household consumption of non-essential commodities, which may affect women employed in manufacturing and service activities not part of the food and health-related supply chains. This includes women in the informal sector. As of April 2019, 10% or 1.4 million of all employed women work in private households. Domestic workers, as we know, are already vulnerable to abusive employment conditions in normal times. So we are also concerned about their situation given their large numbers. They may no longer be taking their days off because of the quarantine or fear of their employers that they might be exposed to the virus and infect the rest of the household. So they could be working 7 days a week. Also, are their jobs secure if their employers' jobs are not? In 2018, almost 3/5 of female overseas workers, numbering 753,000, were in elementary or low-skilled occupations. And we also considered the effects of an economic recession in the receiving countries in terms of their security of employment. Also, according to NEDA, around 100,000 OFWs employed in tourism and tourism-related services may lose their jobs, and this will affect many women workers. Women's employment in the healthcare sector, domestically and also overseas, renders them extremely vulnerable to exposure to the virus. So we ask, are they compensated for this risk? Those employed domestically may at the same time contend with increased reproductive work burdens. And then we flag this. For cash-strapped women, sex work becomes an option, which increases their vulnerability to the virus, STIs, and sexual abuse. There is also the risk of labor and sex trafficking. So NEDA has already forecasted possible negative growth or a contraction in the economy for the year 2020, and a global recession is already underway. So in sum, the economic impacts will be most felt by women in, first, the intensification of their reproductive work, a severe reduction or loss of income in the informal sector, and unemployment in the formal economy and in overseas employment. So that's it. Maraming salamat po.
Maraming salamat, Natsi, for those information. I hope we can share the slides to all of our participants as we collect them. Thank you so much.
Thank you.
Now on to our second panel. We have with us a lineup of panel members and speakers experienced in extending opportunities to women, and we hope to learn from them ways on how to readjust, cope, and recover from this crisis through their personal or organizational initiatives. For our second panel, we have first, Ms. Cheet Juan, co-founder of Eco Store, a store that offers eco-friendly and natural products to sustain lifestyle that cares for the environment. They work with select local farmers and producers that they feature in their stores. Second, we have Ms. Maika Teves, the Executive Director of Spark Philippines, an NGO that promotes women's empowerment through capacity building and livelihoods training for women at the grassroots in partnership with local government units and select diplomatic community. Pepper Limpoco is community developer of Make Sense Philippines, an organization that supports community building through social innovation, civic engagement, and social enterprise incubation, utilizing mixed platforms for communication and exchanges. Ms. Gina Romero is CEO and founder of Connected Women, a global community of women entrepreneurs, freelancers, and professionals. Their platform is host to 70,000 women and growing, that allows for knowledge exchange, opportunities matching, as well as training to transform formal workers to an online work setup. Last but not the least is Vince Rapisura, CEO and President of Social Enterprise Development Partners Incorporated. SEDP is Philippines' premier capacity builder in the fields of microfinance, social entrepreneurship, and financial literacy, supporting in-need and vulnerable communities such as migrants, farmers, and cooperatives in various rural areas. May I now give the floor to Cheet. Cheet, please. Hi, do we have Cheet online?
Yes, I'm here.
Thank you, Cheet.
Can,
Take it
can you
away.
hear me?
Yes, very well.
Okay, my sharing will be, well, let me time myself, okay, so that to give way to the others. I think as an entrepreneur, what has been happening for the last 2 weeks, well, this is my 17th day staying indoors, and it gave me a lot of time to think while also monitoring what's going on in the SME sector. Of course, we're also checking on our suppliers. Some of them are from very far away. But what we have realized is that this is the new normal. And so I thought that I would share that everyone, I'm talking about MSMEs, I'm talking about the entrepreneurs, is that we should all think about bouncing back, but doing a pivot. And why do I say pivot? It's because things will not be the same anymore. For example, for Echo Store, we had to close all our mall stores. So we're left with online. And so now we have to make sure that our online works. So if you can give me my next slide, please, Jean. Okay, so for the entrepreneurs, I know the NGOs might find this a little boring, but for some it might be applicable, is that you have to take stock of what you have. Like, what is your network? What are the skills you have as a person? And if you're a retailer, how much inventory do you have? Because that inventory has to be monetized so you can go on and pay your employees, pay your rentals, because even if they say there's a reprieve, etc., at some point they will bill you. So everyone sharing all these tips of CEOs and heads of small companies that are saying we must project like a 6-month cash flow. So for those who are working individually at home and have already been working from home ever since, freelancers, those who do gigs, look at your network, because your network will be your support group as they will also be your customers. So next slide, Jean. So what can you do without a back room? And I think that one is you must, I mean, I just learned, for example, to activate my PayMaya, my GCash just this week. Because a lot of the people I was buying stuff from, were asking for that kind of payment. So when you sell online, you also have to be able to give them different ways of paying you. I mean, not just please do a bank deposit or a credit card. People now want to be more flexible. And then a lot of online sellers don't want to do COD because of the security, or wait, my internet is a little unstable. But anyway, second is whatever you know, whatever your skill is, your talent, think about doing a module and sharing it online. Next is join webinars such as this one. I mean, there's always something to learn. And then of course, you can coach, but you also have to be humble enough to ask for coaching or mentoring. So coach and be coached. Next, please. Jean. Okay. I think what's very important is not having just a support group, but joining a group. That's the slide before this. Jean, don't preempt me. Okay. Like we're blessed, we have a group called PhilWen. Jean, can you go back one slide, please? Okay, join a group. And I talk about PhilWen. So we have 6 organizations under it, but like NEW is a network for enterprising women. So they're young entrepreneurs. Spark, of course, will have the speaker in a bit. Women Biz, who are entrepreneurs who are a little more seasoned, I would say, a little more mature. And then there's support groups. So it's really women helping women, because these women groups know the particular needs of working mothers, of those who have to balance now family and home life because you're now both at home. So there has to be adjustment in even the dynamics in your household. Okay, and then finally, I was timing myself, but I think I'm still good. Okay, 2 minutes. I think what we all have to do is accept that this is the new normal. This is the future. So we have to step into this new world. It's really the end of a world. It's the end of the old world. And we just have to keep accepting that every day when we wake up. And finally, in the last slide, Jean, for mental health. And why do I say mental health? Because everybody, even pets, even dogs are bound to go crazy seeing you every day, you know? So I think it's good to have a chat group, think positive, and never give up. And finally, Jean, is there another one? I think this is something that everyone seems to have forgotten, is to be spiritual in your own way. And I think no matter what faith, you know, what creed, as long as you believe and you can be humble enough, you can meditate, you can pray, and most of all is you must give thanks that you still woke up today. That's all. Thank you.
Thank you so much for those insights and tips, Cheat. Can we now hear from Micah of Spark Philippines? Micah? Hi, Micah. Can you hear us? Can you turn on your microphone, please, now?
Okay. Hi. Hi, Lanlan.
Yes, now we hear you. Thank you.
Okay. Good afternoon, everyone. Well, where we all stand now, our lives have been profoundly changed, but not for the reasons any of us could have expected. The outbreak and the following pandemic of COVID-19 have disrupted our lives profoundly. While many of us are lucky to have safe places to self-quarantine, access to food and supplies, and the ability to telecommute or work from home, a greater majority of people in the world do not. We laud the steps being taken by the private sector to support their workforces, ranging from telecommuting arrangements to support packages. We believe that the combined efforts of the private sector, the public, and civil society organizations can do so much to assist and support the informal sector and society's most marginalized. There has been an outpouring of what we in the Philippines call bayanihan to be of service during this crisis. Mutual assistance by members of community to accomplish a difficult task or overcome a difficult situation. Private individuals and citizens organizations have organized widespread donation drives to provide for the needs of our frontliners and for the poor. Fundraising for meals and personal protective equipment, or creating these themselves to give them to those in need. Individuals such as fashion designers, students from across broad disciplines have put their talents and skills to use to respond to society's needs for goods and tools in the fight against COVID-19. We at Spark will contribute in whatever way we can. Prior to the COVID-19 pandemic, our work revolved around the empowerment of women, girls, and the LGBTQ community. We continue to carry this mandate now, even as the crisis has caused many of our activities to be postponed and our work to be conducted online. We identify numerous additional risks that this crisis has created for the sectors we serve: women, girls, and the LGBTQ+. Suffering gender-based or domestic violence face greater danger from being forced into close quarters with their abusers for a prolonged period of time. National hotlines, such as the ones for violence against women, are not accessible at this time, and that's only if they have an access to a phone. Women and girls in poorer families face depredation of menstrual products, as their families may choose to prioritize food over these others. But nonetheless, crucial and important needs. Many of our beneficiaries are now without an income, a situation that leaves them a great deal of anxiety as well as uncertainty for their futures and that of their children. The journey towards the reestablishment of stability will be a long and difficult one, and the journey towards resilience longer and harder still. But it is a path we are willing to walk because it is necessary and because it is just. We at Spark have begun conducting assessments of the risk areas the pandemic has exacerbated and drafting possible solutions to overcome them. We have begun planning the creation of online content for all the workshops that we conduct, such as women's entrepreneurship workshops or gender sensitivity trainings. However, we recognize that this is only the first step. We have begun scanning among our existing beneficiaries to determine who has the capacity to oversee rebuilding efforts of their own, as no number of needs assessments can replace the self-determination of the women themselves. We find that empowering women in this manner will build resilience in ways that our old methods could not. Both of these solutions cannot be done by one organization alone. And we look to all of you, our countrymen, as well as our partners all over the world, to take part in bayanihan. And we hope we can emerge from this crisis as a stronger, more just, a more resilient society, one unity, one community coming together. Thank you.
Thank you so much, Micah. Can we now have Pepper Limpoco from Make Sense Philippines, please?
Hi, can you hear me well?
Yes, thank you, Pepper.
Thank you. Hi, good afternoon, everyone. I'm Pepper, the community developer for Make Sense, as mentioned. Thank you once again for inviting us to be part of this conversation. So for those who might not be familiar, Make Sense is an international organization. Mainly, we connect the different actors in the impact ecosystem, namely citizens, social entrepreneurs, and organizations from across the Philippines and across Asia. We cater mainly to the youth, but not exclusively, who are mobilizing for different causes that especially tackle the sustainable development goals. And as the community developer, I work heavily with citizens and with social entrepreneurs, most of whom are women themselves. And I think I'd like to take a couple minutes to tell you a little bit about how we work and how we are currently tackling the current health crisis to hopefully provide more insight on how we view recovery and resilience as a youth organization especially. And so I have a few points to share in this. It makes sense, you could say that our impact is a little bit indirect, you could say, as we don't actually go and work with the low income or marginalized or at-risk communities ourselves, but instead serve as the bridge to sensitize people on the issues of sustainability and inclusivity. And once they're already inspired to be involved, then they themselves can go work with the communities on the ground. And so we also support the creation of more social enterprises to really create this pipeline of solutions that solve many of our social and environmental problems. And so what was really imperative for us was to see how we responded and pivoted our operations once the crisis hit, because we knew that many of our social entrepreneurs, enterprises, and ambassadors were badly impacted economically, and many of their employees, many of their coworkers, teammates were also badly impacted. And so we wanted to respond as soon as possible, connecting as many individuals as we can who can collaborate with one another to help the struggling businesses and individuals. And so firstly, we saw this as an opportunity to really emphasize our principle and Make Sense, where we say everyone has a role to play now more than ever. And when we say everybody, we really mean everyone, regardless of professional or academic background. And we work heavily with citizens. So these citizens may be individuals working full-time in a company, but still would like to contribute. Some may be young professionals, some even students. And despite coming from very different backgrounds, they're able to collaborate through the online community that we, together with them, have built for years. So specifically, they contribute and collaborate by things like exchanging platforms, resources, creating avenues such as donation drives, even designing content together. To give you a very concrete example, one of our ambassadors is the founder of an NGO called Project Smile, which pulls together donations for low-income families who are at risk because of the crisis. And so this founder ambassador of ours partnered with another ambassador, her name's Chantel, who is working heavily with the public sector and the mayor of her city in providing these food donations and other material donations by Project Smile to the families in their area. And so it's a very simple but very important example of how people are coming together from different fields. Other ambassadors who are IT professionals, marketing professionals are also working with them. And so they all have this role to play in an initiative despite coming from very diverse backgrounds. And I think these efforts are especially important with the prospect for recovery, as the only way we're really able to recuperate from what we're facing is by collective action. And this collective action, especially facilitated by an established online community, becomes a snowball effect that continues on even after this crisis has ceased. And so that's my first point. Secondly, I'd also like to emphasize the role that the youth is playing in the resiliency building throughout this time. I mentioned earlier in Make Sense, we work mainly with young individuals, mostly around the ages of 18 to 35. And so many of our young ambassadors are the ones who are organizing these trainings, these online webinars, brainstorming workshops, all online to support social enterprises and NGOs and other individuals who are impacted at this time. And another concrete example I can give for that is we have one methodology we use for brainstorming that's rooted in design thinking, wherein we're really able to help a social enterprise in a specific challenge they're facing because of the crisis by bringing together expert individuals from diverse fields to brainstorm together. We actually did one of these problem-solving workshops last Friday for another social enterprise called Greenellas. if you haven't heard of it, you can search it online. It's led by another amazing woman named Camille. And the challenge she's currently facing is how she, together with us and the rest of the attendees, can support her community of PWDs, so persons with disabilities, crafters, the ones who are making her green Ellas or eco slippers, green chinelas, as their operations has obviously halted, and these PWD crafters are now without an income. And so within 2 hours, with the help of 10 attendees, imagine just 10 people from diverse backgrounds, we were able to put together an engagement campaign and a storyboard to help these crafters of granolas. And this is just one of the many examples of how young people are organizing and mobilizing themselves for social impact at this time of crisis. And so we really try to continue to equip the youth, especially young women, to contribute regardless of their background or expertise. And I think lastly, I just want to mention that, like many organizations, we're also adapting our methodologies and tools to a digital platform in response to the crisis. And so we're really motivated to go beyond what we usually do online. Of course, we have trainings online, we have webinars, but we created a platform, for example, that we call Make Sense TV, wherein it is a platform that people use to see, oh, what are the webinars on this topic being conducted? Can I join? All of them are for free. All of them are accessible, inclusive. We did one yesterday. The topic was about how we can build resilient communities for our frontliners. We had guests from PBSP, Bahay Tuluyan, we had a frontliner from RIPM. So things like this, anyone can organize, anyone can join in. We're also in the process of building an online community sprint program, which is, so a sprint program is a 3-week action-oriented online program. And for this one, we're really trying to focus on community building and teaching people who want to become community developers themselves, how can you build the recipe for your community? How can we guide you in creating your community now at this time, for example? And so as you can see, Make Sense is very open source, and we're very happy to share our tools with citizens and social entrepreneurs, because we truly would like to cultivate this feeling of resiliency and especially hope at this time of crisis, and to reiterate that we have the opportunity to adapt and help one another, even if we're not frontliners ourselves. And just to end, I want to emphasize that what most, if not all, individuals, especially the youth, are feeling at the moment due to the pandemic, which is, of course, confusion and maybe a bit of helplessness as well. We're uncertain about our situation. We feel helpless to guide others. There's this feeling of being stuck at home. And so what we really want to emphasize is that despite not being frontliners ourselves, that there's an opportunity to take part in the collective action, whether or not you've worked in development before, and that there's real change to be made, despite being seen as young, or despite, whatever, you're a woman, and that there are platforms actually out there accessible if we want to learn, create, and contribute. And yes, to end, this is really the type of resiliency and transformative change that we aim to create throughout this crisis and despite the crisis, hopefully for women, especially young women out there with Make Sense. Yeah, that's it. Thank you.
Thank you so much, Pepper. Can we now hear from Gina from Connected Women?
Hi, everyone. Thank you so much for having me here today. It's been really inspiring listening to everybody's different stories. I'm just sharing my screen. Can you see my screen? I think it takes a couple of seconds before it actually appears for everyone.
Yes, we can see it now, Gina.
Great.
Thank you.
So Connected Women is a tech startup. We're actually a social impact tech startup, and we focus on technology skills development and online job matching. So this is something that we were already working on for the last 2 years. And as we know, we talk a lot about the future of work and the fact that traditional job roles will be changing. So, our vision is very much about equipping women with the technology skills that they need for the future. I think that the new normal has come up a few times during this webinar, and I think what we're realizing is the future of work. In fact, we had a conference that was supposed to happen this week to talk about the future of work and women in the future of work, and how opportunities in the future of work could actually economically empower women. Well, we all woke up, a few weeks back with the reality that the future of work is actually approaching much quicker and for different reasons. So these are some of the things that we've been working on, programs and platforms. Our focus is job creation through inclusive innovation. So we really look at, actually we started with the middle one, which is helping women transition from offline jobs, corporate jobs, into online jobs. And that's because we know that a lot of women in the Philippines quit their jobs, even though they're highly skilled and highly experienced, but they quit their jobs after they have children because of family responsibilities. In fact, some of the data that we pulled up, although those of you that work in research will know that the data is not that easy to pull up, but some of the data that we looked at indicates that around 5 million women in the Philippines were already out of jobs because of family responsibilities. And that's actually across all different segments, so whether they're underskilled or whether they're highly skilled. So one of the things that we've been working on is helping women transition from online jobs into the freelance workplace, or the remote from work from home or remote workplace. However, one of the things that is very pressing to us, and we were actually planning to launch it this month as well, but unfortunately the offline version of this has been delayed, is helping those underskilled women actually transition to work from home technical jobs. So we've been looking at what are the most basic jobs that can be done with those with very limited connectivity, limited technical skills, and just basic literacy that can be done from home that can help them earn a livable wage. And so that's what we've been working on, which is the first segment, which is inclusivity. And of course, another thing that's very important to us is making sure that local companies and businesses also understand that the workplace is changing, and work with local businesses to make sure that they don't lose their talent as we transition into this workplace of the future. So we want to create programs that help companies understand the importance of providing remote and flexible work to retain their women talent in the workforce, and also to open up their talent pool to a group of people that they may not be able to actually access if they're requiring them to physically attend work in an office. And often this is not necessary anymore. So Connected Women really aims to increase household incomes and to create livelihood opportunities for Filipino women in both urban and remote areas. Our client base is global, so local companies and international companies. So we started our community 2 years ago here in the Philippines, and actually it's global, so we do have some members within the 70,000 women who are outside of the Philippines as well. But it's a very diverse group. So these are the sort of less skilled women who are outside of the formal economy. And it also includes those who are highly skilled, highly educated, or perhaps even entrepreneurs. So this includes all groups of women. We partnered with Facebook and the Department of ICT, and we trained 2,000 women at physical events all over the Philippines in digital skills. So specifically digital marketing for business, or how to transition your offline business into a e-commerce business using Facebook Marketplace. So those are the things that we've been doing before. We also have meetups all over the Philippines, which allow volunteer-led events to happen every 6 weeks. Of course, they're not happening right now, and we'll be transitioning these online. We also have a very active Facebook group where the women in our community can actually provide support to each other. So, and of course, although we're a tech startup, in reality, we're also very focused on the social impact that we create and the SDGs, of course. So we're aligned with many of the SDGs, but of course our focus is number 5, gender equality. And so in terms of COVID, this is really the heartbreaking reality. On the 23rd of March, we created a poll in our Facebook group. We have around 35,000 members in that Facebook group. And I posted up this poll saying, has your household income already been directly impacted because of the enhanced community quarantine and the unknown that follows that? And although I already expected this response, the response was very heartbreaking. Within 24 hours, around 1,500 women responded, saying that their household income was already severely impacted. Now, these are families across a diverse sector. Of course, they're already online, they're already on Facebook, so they're probably not the poorest of the poor, But these are families that were actually able to sustain their daily needs beforehand. And unfortunately now they are not. And this is just some, we had, I think it was over almost 400 comments, and lots of them like this. Single mothers with no income at all, those who are now in a situation where there's no work, no pay, those who are even running businesses like event organizations, or those who are selling sort of like small items from home are now having no income at all. And sometimes they're big families. So I think, you know, we really, really need to find a way to bring jobs to these communities. So these are the 3 programs that we're running. One of them, which is the one that I talked about for low-skilled workers, is Elevate IDA. It stands for Artificial Intelligence and Data Analytics. And we're actually able to upskill women who come from very underskilled backgrounds. If they're able to use Facebook, then they can probably do this job as long as they have a basic device and connectivity. AI data labeling is one of the industries that is growing. And because of the nature of the future of work, it's probably not going to slow down, although it may take an initial impact you know, during this crisis. We're pretty sure that it will be a strong area for us to support in terms of labor. So we really want to bring these programs to those, you know, households that are impacted and don't have an income anymore, or those who didn't have an income before and could really benefit from having some way of earning from home. And I think many of the panelists throughout the afternoon have already you know, expressed and given us plenty of data on why it's so essential that women have access to their own finances and their ability to fend for themselves and fend for their households. We have 2 other programs as well. Elevate EVA, which is really for those who are skilled already and want to transition from jobs that they may have lost into jobs with companies, you know, anywhere in the world. There's quite a bit of data here, but I will share it with you to be circulated after the presentation. But Philippines is actually one of the fastest growing freelance markets in the world. So there is a big opportunity for Filipinos to reskill and upskill to be able to tap into this sort of global opportunity. And ROSA is another Elevate program that we're developing, which is very much about helping businesses really, you know, reskill their teams to be productive in a remote team environment. And it's something that we were planning for later, but I'm getting a lot of people reaching out to me now asking if we can help with you know, helping their company be more engaged online, and how do they manage their teams now that they're fully remote. So just to summarize, you know, what we're doing right now is we're reaching out to partners, especially the big tech companies or the big local companies, but we can work with any companies that are able to provide jobs. So, you know, who do you know who has job opportunities available in their businesses that can be done from home? And, you know, ideally with those in, you know, shouldn't require a very high level of training or skill. If we can find semi-automated or repetitive tasks that already exist within your business that can actually be decoupled from roles that require a higher skill set, I think companies need to get creative and try and create these jobs, because right now people need jobs, and unless we create jobs, then we're going to have a very serious situation on our hands as we try to take care of all of these people that don't have access to any income at all. So that's our ask. You know, we really are looking for program partners who can help us implement. We're looking for program funding, and we're looking for companies to get really creative, especially if you're in an industry that's thriving right now, because some industries obviously are, and you need back-end support for your businesses, then we can help you provide supplementary labor, and we can also help provide incomes to families that desperately need them. And that's it. Thank you.
Thank you so much, Gina. A lot of opportunities now we are seeing from our panel number 2, but let's give time for Vince to share his points and insights too. Vince?
Yes. Yeah. So, hello everyone. Thank you for inviting me for this conference call. So, I'll share to you SEDP microfinance. So, SEDP is a group of social enterprises that provides capacity building and social investments to development organizations and directly to micro enterprises. So today, I will share to you the community assessment we conducted first when the community quarantine started on March 14, and an updated community assessment we recently concluded yesterday or 2 weeks after. We serve 6,600 microenterprises in Agusan del Sur and Surigao del Sur, two of the poorest provinces in the Philippines. Most of our members, about 9 in 10, are women with an average age of 42. These women are typically into vending, farming, fishing, and dressmaking, selling, backyard racing. We asked our members if they had to stop their business if their business weakened, and if they or their family experienced symptoms of COVID-19. Those who haven't spoken with in person or over the phone are marked not reached. The table shows the results of our survey. So let me see how I can show you out my table. Do you see it now? Hello?
We only see your first slide, which shows about the numbers of your micro enterprises served.
Yeah, okay. So, yeah, here. So this is the, how about this one now?
Yes.
Yes, okay. Yeah, okay. So we asked our members if they had to stop their business, if their business weakened, and if they or their family experienced symptoms of COVID-19. Those who we haven't spoken with in the person or over the phone are marked as not reached. So this is the table. So as you can see, with families having to stay home, 4 out of 10 microenterprise stop operating their business because of COVID-19. Another 4 out of every 10 experienced a decline in their business. About 2 out of every 10 members we were unable to speak to because they lived in a remote area or with no cell phone signal. Many livelihoods were affected due to the following. They are unable to buy supplies to keep their business going. Traveling is difficult because there are barangays that don't let non-residents enter, and others can't go to work because the areas where they work are locked down. There are few to no buyers of goods and services because schools and business operations are closed. There are few to no public transport vehicles. They also experience delay in their spouses' salaries. What we've also seen as of yesterday is that most of our self-employed and income earners in the households have not been able to get or receive assistance from the government and have no food due to loss of source of income. So, but the good news is, in the community assessment, was that none of the SEDP members reported symptoms of COVID-19. As it stands, there's an urgent need for decisive action in the form of quarantine measures to prevent the sudden rise of COVID-19 cases. But it's important to take into account the well-being of most low-income groups. It's imperative to provide them support. The sudden implementation of quarantine is difficult for micro-enterprises because many of them earn only enough to meet their daily needs and are living on a hand-to-mouth existence. So what happens now? First, it is important that emergency relief is distributed to families and make sure that there's enough food on the table. Microfinance institutions, such as us, can do this effectively and almost instantly, as we have shown during the Yolanda typhoon. Our clients also keep on asking us what happens to their loans. We've started our moratorium of loan collections. We're also taking this opportunity to shift from conventional microfinance to what we call social microfinance, where we will transform All loans we extended as capital to our members and treat them as true business partners rather than maintain a creditor-debtor relationship. This strategy is very similar to Islamic finance, and we're trying to adapt more inclusive financing strategies to our members. We would also like for government and development organizations to use microfinance institutions as conduits for unconditional cash transfers, as well as for information dissemination. What happens after the community quarantine? Government and development organizations should provide pay-for-work programs to spur local economic development. It would also be good to lobby with SSS and Pag-ibig to make their calamity loans 0%, since these are drawn from the person's contributions anyway. It is also important to focus more on financial inclusion after, to make sure that bank accounts are open for all low-income families so that they can easily access cash transfers and cash relief. This will reduce corruption, red tape, and ensures that funds truly land in the pockets of the vulnerable. In relation to this, we are also wanting the government to have even more basic process is streamlined for low-income groups to get government identification documents, such as birth certificates, marriage certificates, and licenses. Access to basic services starts with identity. This is what we experience on a day-to-day basis with our micro-enterprise clients. It is also high time, I think, to have a universal disaster insurance, since the Philippines ranks high in the World Risk Index. This will make us better prepared for disasters and any other pandemics that may come in the future. We believe that channeling resources to help micro-enterprises, especially women micro-entrepreneurs, will keep our nation strong enough to recover faster from the negative effects of this pandemic. So these are what we've done so far in our organization and what we plan to do after the quarantine is lifted with this pandemic. Thank you.
Thank you so much, Vince. We've heard a lot of information and really possibilities from our second panel. So I feel there is really a lot of opportunities we can also appreciate amidst all of these challenges that we are facing at the moment. I am very conscious of time. We said that this session or conference would close or would end at 4:30, but if we could request for all of you to extend for another maybe 10 minutes so we could open up questions to our panel of speakers for the second round. I see that in our chat box, there has been a lot of questions already and our resource persons are responding on it to it separately. Thank you so much, Sukha, for saying you're good with the extension, but maybe question for all of our second panel members. Could you talk a bit more about the economic shifts that you are really seeing that we need to prepare for post-COVID-19 emergency? And what do you think would be the best ways for us to extend the opportunities that this would open up to marginalized women? Who would want to go first, please? Vince, I see you. Do you want to answer the question?
I think for me, the major shift that we're doing is really to veer away from loans as a strategy for development, because we think that loans is oppressive and it doesn't really put the primary stakeholders into a level playing field as partners in development. So that's what we're doing. Instead of looking at them as a debtor and we're the creditor, where we put all the terms and conditions of the loans for them, and what we're trying to do is to really involve them and engage them in the development of our financial products such that we can respond better and more effectively to their needs. So that's actually already a very, very big shift from the traditional mindset that we have, because even development organizations have that main strategy of access to credit as a means for development. But we think that this could be done through more capital infusion and more collaboration and partnership. So we share in the risks and profits of the micro enterprise ventures rather than just shielding ourselves from the risks as an institution and having the micro enterprises, the farmers absorb all the risks.
Thank you so much for that sharing, Vince. Can we hear from other panel members on the second group? Yes.
I can pipe up. So yeah, I think I just want to echo what Pepper mentioned. I think it's really super relevant. I mean, we have a lot of ingenuity and innovation that we can see before our very eyes right now. I mean, I look at Facebook and I can see you know, entrepreneurs and medical and engineers forming groups and just throwing ideas out there, you know, and nobody has the answer, you know, 100% of the answer. Some of us may have small parts of the solution. So I think, you know, the ability to mobilize solutions is really dependent on people to be creative. And, you know, I'm half Filipino, half British, and I really feel my Filipino sort of ingenuity and innovation. And you can definitely see that right now. And, you know, we've reached out to some companies, you know, some of the bigger companies saying, we need you to come up with jobs. And sometimes the answer is, well, you know, what jobs? Well, you tell me what jobs you have, because we're very flexible. I mean, we're building from the ground up. We don't have the answers. So, you know, why don't we sit, you know, around a virtual table and throw some ideas around about what these jobs could be? Because before COVID happened, we were looking at data labeling and virtual assistant, you know, online freelancing jobs. Right now, we're open to anything. So as long as we can come up with a solution together and innovate together, then you tell me what jobs you have and let's figure out, you know, if we can help bring these to people. And if not us, maybe someone else.
All right, Len, can I say something?
Yes, Chief, please. Go ahead.
Mine is really very basic. Like a lot of Vince's clients in the microfinance, some are urban, but a lot of them are in the rural areas. And it's really about keeping people in a local setting first, because it's the new way, which is actually the old way, where people stayed in their communities and grew their own food and bartered kamote for gulay. You know, it sounded so wow, like slow food, etc. before, but now that's reality. I mean, even among family members, we're swapping vegetables for meat or something, and you have to let it all settle. I mean, the dust will settle, but it's going to take a long time. This is the only time I will sound negative today. But before the dust settles, it's going to be a lot of insecurity, a lot of, and like for connected women, how can you connect them to business now when the businesses themselves will be will be in dire straits? So this is why I'm suggesting for us to like look at locavorism, like trying to keep that economy as local as possible first. It's like quarantine, except there's food, you know? So I don't know how you guys will take that, but it's really what we've been espousing all this time. Like I just woke up the other day and said, oh my God, all my advocacies are actually happening now. We're bartering, we're growing our own food. So maybe, you know, someone up there is making us realize that. So responsible consumption and production, that's also in the UN Sustainable Development Goals, and being responsible consumers and producers. I mean, we can't keep overproducing carrots and throwing them away. We have to also inspire our farmers to grow only what they can sell or what they can use. I'll stop there for now.
Thank you, Cheat. Can we hear from the rest of our panel members before we close the discussion?
Yes, Len.
Thank you. Micah, yes.
Yes. I think what is apparent to us, when the lockdown started, we at Spark, we ceased operations. And I think the first thing we did was we reached out to all our beneficiaries to check on them. And many of them, of course, they come from low income families. So when we reached out to them, many of them needed our help, whether it was financial or whether it was for basic goods. And one thing was very clear, that they didn't even have bank accounts, facilities such as PayMaya or GCash. They didn't have that either. The only reason they were able to reach out to us was because, of course, Facebook is free. And I think it's one of the things that it's now a conscious effort that we have to create, workshops. All our trainings have to be in online. I think the next step is how to figure out and how we can roll them out, especially in areas where there is no internet. But moving forward, that's one of the things I think somebody in the chat group asked what are the initiatives that we have launched or we intend to launch. And I think so far, no, we haven't rolled out any yet during the lockdown, except for really assist our beneficiaries all over the Philippines.
To wrap up, I guess everything that everyone mentioned very concretely, and I definitely agree with everyone, very concretely for us, opportunity comes in the form of our incubation program for social entrepreneurs, especially for minorities and for women, which is still continuing until now, despite this lockdown, despite the crisis. And the incubation program that we run for social entrepreneurs is focused a lot on very early stage. So meaning the opportunity for women who might not have run businesses before, women who may not have any background on anything about management and business, who can apply and who can go through the trainings all 100% for free, connecting them to very specialized mentors, providing them with some monetary support as well, in order to really empower them to say, hey, even if this is what's happening to us despite this crisis, there's still opportunities for you to grow yourself, to empower and have an income despite having everything online. So for us, it's really about the incubation program for social entrepreneurs, which is the opportunity we offer to all.
Thank you so much, Pepper, for wrapping that up for all of us. I think our second panel really has presented a lot of different options and opportunities we could look forward to, but at the same time prepare, as we are right now on lockdown. And I appreciate really the important role of the different bridges so that these could really be accessed and this could be linked to women the communities who does not have access to infrastructure, to proper internet connection, to financing or loans, which is now really a very welcome development in terms of how we can shift and move this forward to a more inclusive financing, which we hope really we could dwell more upon in the future conversations. It is quite really a long discussion, overwhelming but enlightening at the same time. We recognize it's too much for all of us to take and process, but we want to really spend some time to slowly digest all of these things. And I would like to call on Nancy Pereña to share with us the key highlights of the conversation. She's the one helping us put together a report from this conversation, a social worker and a senior lecturer from the UP College of Social Work and Community Development at the University of the Philippines. Nancy, please.
Oh, hi everyone. Am I coming clear?
Yes, you are.
I think I'm yeah. Okay, I thought I might be having internet connection problems. So anyway, my role now is to synthesize the forum, what we have talked about, which is really a big task, given the diversity of ideas, the range of ideas that were presented. But I'm hoping everybody has taken down notes like me, so this will be quite easier to do.
Sorry,
What I'm going to, hello? Yeah?
We can't hear you clearly.
Oh, okay. So maybe I'll just, is this okay?
Yes. Better.
Okay. All right. So what I'm going to do is just present the major ideas which might provide us with some grounding on how we can move forward or think about our next steps after we've signed out of this webinar. Again, this is just a drop in the bucket. We're just starting a conversation on how the COVID is affecting women. So first point was is COVID-19 is a global pandemic which has national and local impacts, and most often, and I would say this is how we look at COVID-19. It presented to us the situation where it highlighted the gaps in the government responses and also the gaps in how we are working with marginalized groups in the community. The impact is most felt at the local community. So right now, COVID has is this big context that we have in our work, whether you're working with the government, the civil society organizations, or the private sector, we are impacted by this pandemic. It caught many of us by surprise. And some of us have to recalibrate, or many of us have to recalibrate our work systems, our routines to be more adapted to this new situation, what we call now as the new normal. But certainly there will be some groups, there will be some populations which will have a harder time to adapt to this new situation. And it's important that we talk about these groups because when we talk about inclusive development, sustainable developments, these are not just motherhood statements, but we need to make it real, especially at the local level. And that's why we have to talk about women or marginalized groups that are not able to as quickly adapt to the new situation as some of us can do. So the second point is yeah, it's about that. We need to talk about women. We have to take a particular point about women as a marginalized sector in the COVID-19 pandemic, especially because they have been at the forefront. They have always been at the forefront. They have been disproportionately bearing the brunt of any crisis that their families, their communities, and even the nation will face. So especially in the health situation, so that's traditionally assigned to women. But as we've seen in this pandemic, it has become more complex than just a health issue. It has become a security issue, it's become an economic issue, a social issue, and even a political issue when women are marginalized or taken out of this conversation that directly affects them. The consequences of this situation directly affects them. Many of us or many responses have been gender blind because we tend to see the pandemic as a health issue that affects everyone and not just women. So again, we're seeing the familiar pattern of women being asked to wait, sending out this message that maybe gender-based violence, they're important, but let's talk about the pandemic first, as if you could isolate one from the other. So we have a lot of discussion on that during the first panel, but we also see glimmers of hope in this situation. If anything, the Philippines has a very vibrant women's movement, very active women in development here. And some of the things that I picked up from the forum, like in terms of things that we can be hopeful about are, one, there are structures in place that we can maximize so we can reach out to these women for communication, information sharing, for working together. It's not as if we're starting from zero. The long history of work with community women, we've invested in relationships, our social networks are there, and maybe we can tap into this when we want for them now to address issues like gender-based violence and access to social services. Second, yeah, so we might have resources right now in terms of material things, but again, the networks, the opportunities.
I see you're choppy. You need to find
sorry.
a good location. Yeah, thank you.
Okay. All right. So, yeah. So I'm just talking about resources, and part of our resources will always be our networks. Like, yeah. our networks that we can tap into for creative responses and collaborations. And this situation has opened up that space for us to be more creative and be more creative in our responses to this new normal. And finally, another thing that we can be hopeful about is that we will not stay quiet. I think that's one big takeaway for me. This forum is that this is just drop in the bucket in terms of the conversation that we will be having on COVID-19 and its impact on women. But we're starting this conversation, and it's very important to make again visible the women's voices and also their contributions on how this situation is being addressed. So we will not stay quiet. We'll remind people that we are at the forefront. When we see an issue or an opportunity, we act on it and we act on it now. We're not going to wait until the pandemic is over before we start talking about issues on women. So that's it for me, and thank you for a very interesting, insightful forum.
Thank you so much, Nancy. As we draw to close this web conference, we know that there are more questions and more would come up as things further unfold. But we hope that this afternoon's discussion have put into perspective some of our insights and our initiatives in place. I am very delighted to see exchanges of emails, exchanges of possible collaboration in our chat box. Please keep that going. This is the kind of platform we would really want to open up, especially right now. But from our side, as UN Women, We Empower Asia and Oxfam, we have a last note and an appeal to please join us at the We Empower Asia. We want to share the stories of marginalized, invisible, and vulnerable women out there. And through the hashtag Women Rise Above COVID, please tag us, We Empower Asia, UN Women Asia, and the EU Commission. Share with us your stories of hope, your stories of shout out to honor the women you know, and ideas that you could share online about how we as women could work together to rise above COVID. We hope that you stay in touch, and please send us your feedback through the forms we will email after. That would go together with a package of collated presentations from our esteemed resource persons. We would like to extend our deepest gratitude to all of our speakers and panelists for this very insightful and productive discussion. On that note, we would like to thank everyone for joining the UN Women, We Empower Asia, and Oxfam Philippines web conference. We look forward to having all of you again in our future events. Thank you and stay safe. Have a good afternoon, everyone. Jean, you want to play your music?
Ano?